Happy International Nurses Week. You're welcome to Health Awareness Program in our CIRCUMFERENCE. I'm Nurse Blessing Ubon. Thank you for staying with us. And before I start, please click and subscribe. Okay, today we are going to talk on a place for the elderly. Who are the elderly? According to United Nations, there are those people that are 60 years and above, while some say there are those ones that are 65 years and above. How do we take care of them? Sometimes we get so busy in our daily schedule, so carried away with everyday life, that we forget we have elderly ones at home. A fall from the bathroom or a doctor's diagnosis can put you in a situation you never thought you could be, the place of a caregiver. Sometimes it can be so drastic, sometimes it can be so uncomfortable. So what are those things, those measures to take so as to avoid such emergencies from happening? First of all, you determine where you want them to be. Do you want them to stay with you in your place, or you want them to stay in their own home? So, if they are staying with you, you have to make your home accommodating. The way you make your home accommodating for your crawling baby to avoid home accident, that is what you do. You take away appliances from where they should be and keep them in a safe places, and you make sure the floor is dry to avoid sleeping. Then, if they are not staying with you, you're definitely going to need help, yes, a caregiver, because they won't be able to stay alone. They won't be able to do it alone. So you hire a caregiver to stay with them, and you keep track of them. How do you do that? You get a mobile phone, an affordable one. Everyday call, conversations, and reports on how they are doing will help you to minimize any problem from forthcoming. Apart from keeping track of them, if they're not going to stay with you, try as much as you can to visit them, yes. Because if you don't visit them, they'll feel lonely, they'll feel depressed, they'll feel abandoned. They'll be like, after all, he's spending his money on me, doesn't care about me. So show them you care by visiting them, by reminiscing on those good old age, by having loving memories. That is what you do. And when you do that, they feel loved, they feel belonged, they have those reasons to keep living. You lift their spirits up. What next do we put in consideration is exercising. You know, when old age comes, the muscles, they kind of become tense, they don't relax the way they should be, yes. So when they exercise, it's not the skipping, it's not the jogging. It's like early morning stroll, evening stroll, or brisk walking will go a long way. It helps them, it makes them active. So encourage that. Eating habits. Healthy food goes a long way. Yes, it protects their organ, it helps their skin, it helps them. Foods like vegetables, fruits, high fiber diets, and copious fluid, not carbonated drink, no. Like smoothies, water, lots of water. It helps their skin, it helps their organs, it rejuvenates them. So try as much as you can to help them eat healthy. Doctor's visits. Medical checkup matters a lot in taking care of the elderly. You know why? They are prone to disease conditions because their immune systems get reduced every day. And if you want to avoid emergencies from happening, if you want to avoid them from falling sick unnecessarily, you make sure you book an appointment with them and keep a medical checkup routine. So many diseases comes with old age. Sometimes it might be because of their previous way of life when they were young, like smoking, excessive drinking, and eating unhealthy diet. It might result to cardiovascular problem, it might result to diabetes mellitus, it might result to hypertension. And other diseases that comes with old age, which are like visual problems, auditory problems, renal failure, kidney problems, osteomyelitis. Yes, the bone problem, it comes so much in old age. You see them having difficulty in walking, you see them having pain. So with a regular medical checkup, it helps eliminate these pains, it helps eliminate further problems from happening. And when they go for this checkup and they're being given medication, please try as much as you can to label them. Don't just drop them and leave. And don't just let the healthcare giver just give anyhow. You make sure the drugs, each of them, are being prescribed, written, the prescription are being written accordingly so that they can take the right drugs at the right time. And the course of taking care of them, always have in mind that they have to make a good will. Visit a lawyer. When you visit a lawyer, talk to them on what to do. I know it's a very difficult issue to bring up because of like, am I going to die tomorrow? You want me to die this? Or you want me to die so that you can take my properties? No. A good will eliminate controversies among children when they are gone. So when they know the importance of a good will and the power of attorney in their own health, they know that it is very important for them to do that. In the course of taking care of them, take care of yourself. Yes. If you come visiting them and you look tattered, you look worn out, you look depressed, my dear, it will affect them. It will be as if they are the cause of you being this way. But when you look positive, when you look happy, when you look cheerful, when you look radiant, my dear, it will make them feel good. It makes them have a purpose of living. It brings out that positivities in them. So try as much as you can to look good. Visit them often. Have little parties. Make them feel belonged. Visit their neighbors because they might be of help when that time comes. And taking care of them. Always have it at the back of your mind that we will all grow old. Yes. So when you have a positive mindset in taking care of your elderly ones, someone definitely will take care of you. And our God in heaven will always be there for us when that time comes. Stay blessed, stay positive, and be always helpful.